All right. Hey, welcome back to Instagram or YouTube, wherever you're watching this Q&A. I'm Dr. Jordan Feigenbaum with Barbell Medicine. We're doing our standard Q&A here. It is Thursday, July 19th, and we're going to open up the floor. I don't have anything that is specifically on my mind except for maybe this busted sign behind me. I was so bummed. I'm not leaking noble gases into my home right now. That sign doesn't work. Otherwise, it would be illuminated. We'll take questions from here, both on Instagram and then on YouTube, depending on where you want to watch it. Cheers. Can you tell how restless I am? Because it's a deload week for me. So there's not a lot going on training wise. So putting together another training vlog video for you guys. I thought I would do this Q&A, and people seem to like when I was doing it on both YouTube and Instagram. So Shafiq, dude, the hats I think are going up tomorrow. So yeah, we'll get you one of these sweet Barbell Medicine hats. Kevin MJ from YouTube asks, when is it appropriate to do sumo deadlifts? So the idea that sumo deadlift is an inferior type of deadlift, I just don't want to perpetuate that. I think it's just fine. When should you do conventional or sumo? And I don't really have a preference without any more context. So it's like if somebody can pull much more consistently, technique wise, has less form issues, and prefers to pull sumo, that's fine. You can live a full and normal life pulling sumo only. If someone's going to do Olympic weightlifting, if someone can't pull or prefers to pull conventional, then I think conventional's the ticket. I think that the demands on hip mobility are probably a little too high on sumo deadlift to make it the default deadlift, but I don't really have a problem with it otherwise. Yeah. So, all right, let's see. Move up here. Ways to help elbow pains at the bottom of a bench. Yeah, I think the first thing I'd look at is the squat. If the squat might be causing the actual elbow pain, so that would be kind of where I would start with, just as far as if you're holding the bar correctly. So I would read my article, The Elbow Problem, and go from there. Someone said they started the 12-week strength template. Which slingshot do I recommend? I like the red one. Yeah, I don't actually know what the name of that one is, but the red one or the blue one? Red or blue? Let's see. Tips for overcoming sciatica. Squats and deadlifts. Yep. All right. Let's see. Can I do other upper body movements for the 8-minute AMRAPs? Oh, for like GPP? I mean, can you? Sure, you can. But I don't necessarily know if that's the best way to train them. I mean, you're using the AMRAPs to control how much time you're spending on doing not what we would deem non prioritized lifts, and I just don't know how much of that you should be doing. So, hey Doc, for the last time, and sorry in advance, what is the song? Yeah, so for the last time, I actually don't know the name of the song. Yeah, sorry, man. What is my favorite lift? The forklift. Yeah, because you take the fork and then you make the food go in your mouth. That's my favorite. So, am I planning on competing in the near future? Nay, I am not. Let's see. For the first meet, if all goes well, should my third attempts all be PRs that I never hit in training? For your first meet, maybe. But then again, maybe not. I mean, the goal of a meet is to be as competitive as possible and to make all your lifts, right? So if you can win and if you don't necessarily need to reach for something that you haven't hit in training, then maybe going 9 for 9 and leaving 2.5 kilos on the platform on each attempt is okay. And you may or may not have hit that in training. So there's too many variables to really say that. Yeah. All right, back to the grams. What was in the crate? That broken sign behind me. Yeah, so if you follow me on Instagram, Jordan_Barbell Medicine, there's you saw the I saw there's a pallet, and that neon sign came in there. Except for right now, you'll notice it's not illuminated because it's not working. Paz asks, are there any research on collagen to help repair an injury? So there's some data suggesting that if you take collagen peptides, it's like 12 grams either from collagen protein or from gelatin, 12 grams of that prior to training, that you get increased collagen remodeling. Some evidence that if you take that with a small dose of vitamin C, which you could really get from like half of an apple, like 50 milligrams, it's really nothing, that you can maybe get a little bit better repair. But as far as how that affects outcomes like pain and function, that's a little bit less clear. Here's the most interesting thing, that collagen protein actually has better data on it than stem cells do for joint pain. So, and you may be saying, well, what, man? It's like, yeah, because stem cells don't have good data on for joint pain, just in general. Let's see. Chandler Hatch on the YouTubes asked me, would you ever gain weight and lose your abs to increase your lifts? I already did that. Yeah, right now, it's not, I mean, I'm not like shredded. I have abs. I'm happy with my body composition, and, it's just living my life. Yeah, so it turns out that your priorities will change over time. So, let's see. What do I think about barbell hack squats? I don't think about them. Yeah, I think that there are better options to do with the barbell, and if you have machines, I would do hack squats or leg press or belt squats on those. Hey doc, my mom has cracked spinal cord discs. No, she doesn't. And was curious to know if senior barbell training could reverse the pain for recovery. So it's not unusual to have herniated discs as we age. That's expected. So cracked discs, that's interesting. Will barbell training help her? Well, likely. Yeah, it depends if she's got a bunch of pain and what she needs to work through right now, but she probably should train, rather than not train. What are you going to do? Not train? Do you mind elaborating more on the physiological part of all muscles pull statement? I mean, sure. All muscles pull, and in that they try to approximate or shorten the distance between the proximal attachment and the distal attachment, or the origin and insertion. So that's all pulling. There's no pushing. No muscles extend to create force to extend. So even your triceps are shortening in order to extend your elbow. There are no muscles that push. There are muscles that contract and shorten, right? And through their series of bony levers, which is your skeleton, or their orientation, end up pushing something, like the muscles of your tongue, right? Will end up pushing your tongue out. I believe that's the genioglossus, but don't quote me on that. Anyway, there are no muscles that push. No pushing muscles. So, there you go. Thoughts on pulling mixed grip versus same hand over and under always? I think that's probably the best way to do it, mainly because you're trying to condition the underhand side to tolerate the stress of pulling supinated. Not finally, but the other thing I would say is that the risk of biceps tendon rupture secondary to supination under load is relatively low. I mean, it'd be a statistical sort of error in calculating the number of injuries from weightlifting at large. It's just not a lot. So I just wouldn't worry about it, and I think that anybody who's making training management decisions based on the theoretical risk of biceps tendon ruptures, and somebody who doesn't have a history of biceps tendon rupture, right, is making a mistake. So, yeah. Is power building actually possible? I mean, yes, I would argue that any good strength conditioning program should have a significant hypertrophy component to it in order to get stronger, since strength is directly related to muscle cross-sectional area. So power building should be a mix of strength training and, hypertrophy work, which is what that's a normal strength conditioning program. I think power building, all it does, the biggest difference from that and bodybuilding is that you're not willing to compromise all of your training for just higher volume hypertrophy work, because you actually want to be strong too. So that's the biggest difference. Yeah. Let's see. Chuck asks, I don't want to lose strength gains, but want to drop another 60 to 70 pounds. Those are like two different things. So let's see. Should I do more GPP and keep volume the same, or will I have to sacrifice volume and lose some of those sweet gains I made? I don't know if I would actually necessarily lose or drop the volume. Yeah. I don't, that seems like a bad idea just in general. Um, the other thing I would say is 60 to 70 pounds sounds like it's going to take a long time, and so you're likely going to have to change your programming anyway. Um, it'd be hard that at no period of time would you drop your volume. I think you're going to have to do that. So let's see. Do you know of any references offhand that study or compare the benefits of using unilateral work to general bilateral strength, specifically to improve lifts such as the big three, for example? I don't know any studies offhand looking at that. Patrick Johnson, I've also been having sciatica for about 6 weeks now, but I'm unable to squat deadlift because of a broken humerus. Oh, fun. Should I just hip hinge and do body weight squats in the meantime? I mean, that's going to be tough with the broken humerus to do much productive training. I don't know about what a hip hinge is. You can't squat or deadlift. You could safety squat, right? Do safety bar squat. You do that. Right. And Corvallis Real Estate. I'm in a calorie deficit and have lost 8 pounds this month to 145. I'm exercising daily, feeling kind of faint, groggy in the early evening. Best to cut exercise or eat more? Probably neither, because I don't think either is associated with feeling faint or groggy. Feeling faint, I'm not trying to minimize your symptomology here, but that doesn't mean anything really. That could be anything. It could be nothing, very likely. So I don't think that's related to a calorie deficit. 8 pounds in a month, 20 days in isn't, I mean, that's a good amount, but it's not like, oh my gosh, you're just hemorrhaging weight. And I don't know what you're doing for exercise, but unless it's significantly, altering your fluid balance or salt level or something like that, I probably wouldn't do anything about it, to be honest. All right. Why do you not program push press? Does it not help the press some? I program it sometimes. Yeah. So I think the more athletic a person is, the better the push press works for them, usually. Let's see. Trying to lose as much weight as possible, doing cardio 5 to 6 times a week. Should I be doing more high intensity interval training or low intensity steady state? Either. Yeah. Who would you rather coach, Gordon Ramsay or Jordan Peterson? I think Gordon Ramsay would be a savage. I think he would, like just under the bar. I think he'd be fun. I might be sad coaching Jordan Peterson. Yeah. But I would want to talk to him. So there you go. I don't know. I think I'd rather talk to Jordan Peterson. I'd rather coach Gordon Ramsay. Yeah. Have you coached anyone with fibromyalgia? Yes. What recommendations would you make? I wouldn't necessarily train lighter during a flare-up. No. I think that if you get a person with fibromyalgia to train, then they're going to dictate, what they're going to do during a flare-up or not. Do you think there's any danger of drinking out of plastic containers? Nope. Let's see. How heavy should I curl to blow up my biceps? Well, I think that depends how much explosive material you have, right? I mean, the more explosive material, the less you're going to have to curl because you just blow up earlier. I think if you're asking me, well, how much weight should you use? It doesn't really matter. I typically stick in the, if I'm going to do curls or program them for people, I like them to do 10 to 15 reps per set, sub-maximal, and do more and more sets over time, more and more days over time. That's how you grow your arms. How do you balance hypertrophy and strength? I'm not really sure what that means. How do you balance hypertrophy and strength, or is there any data on ideal periodization of these two? Yeah, concurrent training works better than conjugate. Concurrent means you're doing it at the same time. Conjugate means it's back to back. Don't confuse conjugate periodization with conjugate like West Side. Those are two different things. Apparently, Louis wanted to use a word that was already taken. Let's see. The conventional deadlift has jacked my back up at least 3 years, thinking of packing it and doing sumo. That's fine. I don't think there's any negatives to not training the conventional deadlift, except for not being as good at the conventional deadlift. So, how much does behind the neck press help with increasing strict overhead press? Not that much in general. I mean, the thing is, it's not terribly specific. It's not really overload, and it doesn't really fix any potential technique errors. You're limited in how much you can program it because most people don't tolerate a ton of it. So, yeah, not really that great, to be honest. I would just overhead press more for sure. Yeah. Do I ever program in reverse hypers? No. No. Yeah, I don't think they do much of anything. Outside of variations of the big three lifts, what assistance exercises do you think give the most effective? Are the most effective at increasing the big three? Just variations of the big three. Yeah. So, for the deadlift, pause deadlift, deficit deadlift, deadlift plus chains or bands, pause deadlifts, rack pulls, mid chin rack pulls, stuff like that. Stiff legged deads, RDLs, rows. Yeah. So they're all like fairly closely related, except for maybe the rows. Lee Dubois asks, can you elaborate on the myo reps that are programmed in the hypertrophy template? How exactly do you do them, and what is the training goal behind them? Sure. So the idea is you'd find like a set between 14 to 20 reps where you had about 2 reps left in the tank, right? So you would warm up by doing sets of like 14 or so, or 15, pick a number, doesn't matter. And work up to a weight that feels like an 8, two reps shy of failure. So it's going to feel hard. Rack the bar. Take 5 deep breaths. This is about 20 seconds total, okay, as the bar is racked. Then unrack the bar. Do a set of 5. Rack the bar. Again, 5 big, long, deep breaths. This might be another 20 seconds. Unrack the bar, do a set of 5. And keep doing that until you do 3 reps or less. And the idea is that the first set fatigues you enough so that you're recruiting a significant amount of motor units. All right, and you can do that by fatiguing the muscle with a high rep set, and then you're gonna the sets afterwards get full motor unit recruitment because of the shortened rest periods. So the idea is that you get to jam in a bunch of work in a short period of time that's useful. What is speed work in the templates? We don't do that. Anabolic structures. Do you think there's a need to supplement with vitamin D if one gets very little to no sun exposure? Not necessarily. I mean, you'd want to get a vitamin D laboratory assay to ascertain whether or not you should supplement vitamin D. I think supplementing without laboratory evidence that you have a deficiency is unwise in general. Shemaya says, I'm experiencing above the knee sharp pain when I squat. Pain disappears after I warm up. I also feel the pain when I get up from sitting and when I climb the stairs. Any suggestions? I have bad knees. Well, if you think you have bad knees, you're going to be focusing on your knees and continuing to believe that your knees hurt. And I'm not trying to say this all in your head. That's not what I'm saying. But if your expectation is that you're going to have knee pain and you pay a lot of attention to your knees, you're going to have knee pain. So what would I do about it? I wouldn't do anything. If you don't have pain after you warm up, that's sweet, man. Carry on. Carry on. Jordan, how is your arm hair so HD while adjusting the camera? I think it's just a lot of it, just a lot of hair. Do you have any suggestions for tendinopathy in elbows, biceps? Well, the elbows are not a tendon. Biceps tendinopathy is a thing. Switch to high bar back squat and pin benches. Bicep pain is better, but elbow pain remains. Slow eccentric curls seem to help. You can keep doing that. If you have elbow pain while you're squatting, I would adjust your grip. Pin benches, I might do tempo wise, and this stuff's probably just going to get better with time. Yeah, be aware of heavy loading for a while. That doesn't mean you need to stop all of it, but you could. You're trying to dissipate some fatigue, really. Let's see. Let's see. Oh, hey Jordan, I lost a lot of weight, 260 pounds to 165. Hey, that's great, man. Over the course of a year, maintaining my strength throughout, looking to transition to gaining muscle mass and strength. Best way to go about this: slowly increase on a calorie deficit while volume goes up, gain some muscles. How do I find a physician that's going to be knowledgeable in the world of fitness? You won't. They don't exist. Yeah. So don't try. The point is, you don't need your doctor to be knowledgeable in the world of fitness because you're not asking your doctor to coach you, right? What you want is good rapport with your doctor, and you want good availability to get in when you need to be seen, right? And you want them to be well educated for all your general health stuff. For anything that's related to fitness, you probably need a second opinion if that you really, you need somebody who knows both things, and you're just not going to find that in the medical world. So you're not going to find that in the chiropractic field. You're not going to find it in the physical therapy field. And I'm not just saying bad things about them. You're just not going to find it, okay? Which brings me to an interesting thing from today. And this was on a vlog 2 vlogs ago. If you recently had surgery, right, and your doctor says, hey, you can't train, you can't do anything for like 2 weeks, 3 weeks, 4 weeks, where does that recommendation come from? Thin air. It's just, they pulled it out of thin air, and they said, yeah, that sounds right. That sounds right. It's not based on evidence, because the existing evidence that we have on certain surgeries, like knee replacements, hip replacements, breast cancer, like radical mastectomies, these very large procedures all show that resistance training early on, people do better, or at least don't do worse. So, and what I mean by worse, I mean complications. Now, doctors will say all sorts of stuff to the contrary. They just don't feel comfortable routinely recommending people go do resistance training right after, post-op. And that's fine. But you have to understand that recommendation is not based on evidence. It's based on somebody thinking about it for 30 seconds while you're in front of them. And it doesn't mean it's wrong. It doesn't mean you should disobey that. It just, you got to take it for what it is. All right. Most impressive lift you've seen in person. All right, well, so here's what happened. 2013, I'm in Orlando, Florida. David Ricks, 53 years old. I see him walking around the back warm-up room, and I didn't know who he was. And if you don't know who David Ricks is, after this thing's over, go Google David Ricks. He's a short, stocky, well-muscled dude, and he's 53 years old. This guy's got a Titan singlet on, Titan shirt, old safe squat shoes that they don't even make anymore. I was like, this guy's an OG. He's in the master's class. He's definitely not in my weight class. And if he is, he's not open. He's masters. This dude's old. He's old as time. And he smells like Ben Gay. Like he took a bath in Ben Gay, like top to bottom. I don't know. He had it in his eyes, had to rinse it out. So it's David Ricks. Now it turns out he was competing that year in the 93 kilo class open. And he opened at 606, which was 10 kilos heavier than anybody else opened. His second attempt was 638 or 632, something like that. Smoked it. I mean, it looked like he did it on a set of 5. Then he goes up to 660, 300 kilos, 661 rather. He goes down and up so fast the bar jumps off of his back and he has to take a step forward to catch it. At that time, that would have been a world record. In fact, Lane Norton set the world record in that weight class at 661 3 years later, but David Ricks was ahead of him. Dude was crazy strong. He ended up crushing us that day. He pulled over 700, benched over 420. I mean, the guy's a savage. That was not the most impressive lift I've seen from this man. The most impressive lift I saw from this man was in 2017 at the Arnold when he squatted over 700 pounds raw as a 93 kilo lifter at 58. So, I don't know if I can lift weights anymore since that's happening. Any diet tips for someone with hemochromatosis? I wouldn't make any special dietary changes for someone with hemochromatosis. You have to be managed medically based on your symptoms and lab values, but no diet thing's going to help or hurt you, really. Except, don't supplement with iron. Should I stop benching if I have tennis elbow? Not necessarily. Not necessarily. Tempo work might be good, but in general, lack of activity or cessation of activity for tendinopathies does not help. Do I ever program neck work such as bridges? No, I don't think that neck work is terribly useful unless the position that you're getting into to train your neck is something that you're exposed to in your sport, in which case it's really just practice, right? Dr. Jordan, is there medical literature around fasting? Yes. Autophagy, which is killing senescent cells, increasing growth hormone. Of course it does. So killing senescent cells, that's happening all the time. Cellular repair and cellular, remodeling, turnover, that all is happening no matter what, fasted or not. Okay, if you're fasting, sure, you're breaking down more cells, but who cares? Growth hormone goes up because it's an energy regulating hormone. So as your glycogen stores drop, as your energy stores drop, guess what goes up? Growth hormone, but it doesn't do anything, right? People who get this, a tumor in their pituitary gland where they're just dumping a bunch of growth hormone, they don't get too jacked. They don't come to the hospital or they don't come to the clinic because they're too jacked. They come to the clinic complaining that they have carpal tunnel, their jaw's getting bigger, their abdomen's getting bigger, and then they've got to pee a lot and drink a lot because they've developed diabetes from too much growth hormone. So, yeah. Hey, Jordan, if there are 2 meets in a row, like 30 days between, how should you prepare for both? You can't. Yeah, you can't. That's poor planning. I mean, I probably wouldn't. One meet has to be more important than the other, right? They can't be equally important. So the more important meet, that's the one you should peak for. The one that's less important, you should use it as a training meet, meaning that you may do the meet and then after each attempt, you may do some reps. So at the end of the squats, you did 3 singles that you work up to a heavy single for the day, and maybe you do a couple sets of 5 in the background, right? Or you don't do that, you just do the meet normally so people don't look at you crazy in the warm-up room, but you trained normally the whole week and you just went to the meet to practice. So, let's see, I hit a 200 kilo squat 4 weeks ago. On the last block at a 9, coach only wants me to squat 205 for a third in a month. Sandbagging? I don't know. You ask your coach. Any particular template you'd recommend for temporary focus on dropping weight? The hypertrophy template's pretty good. Yeah. Lane Folks, what's up, man? When would you recommend someone to choose to train high bar versus low bar squats, such as certain anthropometry? Yeah, so I don't think there's a particular anthropometry that like automatically before doing low bar I would prefer. I think that basically if you have somebody who's never squatted before, they're totally green, and you have them do low bar, right? And you can't get it to look good. You can't get it, and when I say good, I don't mean like aesthetically pleasing. I just mean like repeatable, and they have constant issues getting to the bar position. And at that point, you're like, well, is this really a good way for them to train their squat right now? Probably not. It doesn't mean they should only do high bar squat from then on out, but it also doesn't mean they should just do low bar. So yeah, I would recommend changing to a high bar squat or vice versa to low bar squat if someone is having problems repeatedly training the other one and it's not very consistent technique wise. I mean, because ideally the best way to pick a squat style or a bench grip width or a deadlift style is which one can you train most consistently for the longest period of time without injury, to the degree that style has anything to do with that. And here's the fun fact. High bar squat and low bar back squat, same amount of muscle mass being used. The idea that you're training significantly more muscle mass in low bar squat is patently false. You can keep saying it on the internet, to rationalize why you have people do low bar squat, but the data right now, there's no data suggesting that unless there's more weight on the bar, right? If there's more weight on the bar, you'll put more force into a force plate. That's true, but no more EMG activity at the level of the muscle. Oh, and then you just say, well, EMGs don't mean anything. It's like, okay, you don't get to make the rules. So, all right. Kyle, we'll just call you Kyle. How important is it to shrug your overhead press? I find that if I shrug conservatively, it feels fine, but if I shrug really hard, my left shoulder consistently pops. Conservative shrug, I'm not sure what that means, but conservative shrug on. I would hate for you to like liberally shrug. Liberally shrugging is a dangerous game. Sorry, someone has to laugh at my jokes, right? I'll have to laugh at my own jokes. I don't care about your shoulder popping, and you shouldn't either. But you can shrug conservatively if that's better. Let's see. Jordan from Down Under. Similar to hypertrophy adaptations, ergo 30 to 60% depending on the research. I don't know the first part of that question. Sorry, dude. Coastal Muay Thai. Haven't been able to get my lumbar spine as flat as I'd like recently, even with a light weight. I have been block point and can get back set. With the info you're given from this, are there any other subs? I would do block pulls. Yeah. And I would lower it over time. And the other thing is, though, I don't necessarily know if your back rounding, if your back position isn't like egregiously bad off the floor, then who cares, right? Let's see. What's up with you guys and Myo Detox? I think we're both blocked because Myo Detox is trash. If you're watching this Myo Detox, you're trash. Let's see. Whew. Oh, I missed some of these. We're going up. I had a friend who got a diagnosis of degenerative disc disease. He wants to train but is afraid to start because of risk of injury. What would you tell him? If his doctor's cleared him for exercise, which you said, he can train. Everybody's gonna have some level of degenerative disc disease. Current evidence suggests you should train. I would train without knowing anything else more about this guy. Should one supplement with vitamin D and or calcium for a broken bone? No, unless you are in the age range where they're recommending it, so you'd be an older person or someone with a calcium deficiency for whatever reason. Yeah. I've been doing 5x5 overhead press work twice a week and have stalled. Any assistance I should be doing to aid? Well, I think that just doing 5x5 ad nauseum is unlikely to work in perpetuity. So, yeah, you should probably press more, but you should probably alternate your pressing regimen. Let's see. I respond very well to higher volume and frequency on bench and squat, just like everybody else. Doesn't seem to help your deadlift much. Why would that be? Maybe you need different average intensity, and maybe your amount of volume is incorrect, and maybe your technique is not terribly needs some work, and maybe your supplemental lift selection needs some work. Yeah. Feelings on fish oil supplementation. Fish oil supplementation is garbage. Doesn't do anything for most people, including for joint pain. People are like, oh, but it's helps with clotting. If it's like a blood thinner. No, it's not. They won't even have you stop it before surgery. There's no evidence that actually increases bleeding time. So that doesn't really help. Is no evidence that it's heart healthy. In fact, the only data we have long term suggests that it's maybe worse for your heart. I mean, not really worse for your heart, but the outcomes are worse. We don't have any direct physiological mechanism that shows that it's worse. But the outcomes associated with the long-term studies like DART2 trial suggest that it's not terribly great for you. Some evidence that at high doses it increase particular some neoplasm rates. That's some potential cancer risk. It does lower triglycerides if your triglycerides are really elevated, but they need to be really, really elevated, and then you should probably be on a different medication instead of just fish oil. So should you take fish oil to prevent anything? Well, no, because it doesn't prevent anything. You might take it if you have childhood asthma, if you have cataracts, if you have some forms of schizophrenia. If you're pregnant, you should take some EPA, but that's in your prenatal vitamin. Other than that, people pushing fish oil just don't know things about supplements, but they got something to sell you. I mean, do you know how much money I can make if I came out with my own fish oil? Right? Like, I can't do it. If you have rheumatoid arthritis, maybe there's some stuff there, but not for any other joint pain. People are like, oh, my joints feel better. It's like, dude, it's placebo. That's fine. But just do something else. Maybe your joints just don't hurt. So, favorite guitarist, Joe Bonamassa, for sure. Yeah. Who all is going to be at Toronto seminar? Drake, myself, Austin Baraki, Dr. Austin Baraki, Leah Lutz, and Tom Campitelli. Have I watched Clarence Kennedy? I have. What do I think of him? I don't. I mean, I think he's an impressive athlete, but I don't know how impressive because he doesn't compete, right? I think people talk about him a lot, and that's cool for him, but I think if you want to be judged as an elite level weightlifter, then you have to compete against other elite weightlifters. And right now, the other elite weightlifters are out totaling him, on the platform. It's just like if my whole thing was built upon being a great powerlifter, but I never competed, you'd be like, bro, why compete? But I already did that, So in practical terms, if any elderly female only ever deadlifts 30 kilos but for loads of volume, will their bone density benefit to the same extent as the female deadlifting, say, 100 kilos for equal volume? No, that's not true. I said that yesterday. It's volume. There's a volume threshold, but then the absolute load is important too. Yeah, so it's not only one or the other, just like everything else. London girl spilling ink. Hello from the UK. It's 3:30 in the morning. What's up? I feel like this is like an intro to a Drake song like Hotline Bling. Good morning, London woman. That's funny. When your clients want to go for a gaining phase, you always recommend 500 calories above maintenance. Not necessarily. Are there scenarios when you advise a slower bulk? I mean, I think if you know somebody's maintenance calories, you just go up a couple hundred calories. Maybe it's not 500. I mean, where's 500 come from? Oh, because 500 times 7 is 3,500. That's how much 1 pound is. Yep. Unfortunately, your body is not just like this bomb calorimeter or calculator. It's just like, oh, do, 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 and, gains 1 pound, just like it doesn't always lose 1 pound. It's different. So I make smaller changes usually. Just a heads up, the YouTube stream is skipping by a few seconds every few minutes. Oh, it's probably the internet's, because I'm trying to broadcast in higher definition. My bad. Jordan, why you know Twitch? I don't know. I'm not on the Twitches. Let's see. Do you recommend any weightlifting in programming to increase power in main lifts? No. No, I think the carryover is pretty low in general. Yeah. Do you think relaxing the low back into complete flexion between reps when deadlifting and rowing is a bad habit and should be avoided? I don't think it matters. Wonder if this flexion extension cycle is setting off my back. It's probably not, no. Can you explain why foam rolling doesn't do much? Yeah. So foam rolling, here's what foam rolling does. It takes a cold muscle, if you're previously not exercising, previously not training or doing anything, and it increases the temperature, which decreases the viscosity, makes things slide a little bit better, which makes you feel like you move a little bit better. It transiently increases range of motion, but not any more than a regular dynamic warm-up, like just moving around. And since it costs time to do, and it's not specific to anything except for rolling on a foam roller, then it costs training time, which is bad news bears, right? And then on top of that, it decreases force production. So then it might compromise your training results. And it doesn't prevent injury. It doesn't improve subjective ratings of soreness. So why are you doing it, Yeah. What sources would you recommend for health-related topics? Ergo, cholesterol. Well, that's not a health-related topic. Dr. Baraki recommends the Pain Science site for pains-related issues. There's no one online repository to learn about health stuff, unfortunately. Up to date, if you got a subscription up to date, sure. I do boxing 3 times a week and strength training. What to do in days where I do both? Strength training first. Consume more carbs. I don't know, if you're losing weight and you don't want to lose weight, you could add carbs, sure. But if you're not losing weight, you're by definition in calorie maintenance, and so maybe you don't need to do anything unless you want to gain weight. Let's see. Do I have any meets planned in the next 12 months? I do not have any meets planned in the next 12 months, but to be fair, I don't plan meets like a year ahead of time. So no meets in the next 3 months, but maybe after that. Oh, gosh, I love Diet Coke. Is there anything wrong with a 6-day per week push-pull leg split? I mean, yes. Training 6 days a week with a bunch of volume, I don't know how you're going to do that if you're not an elite, higher level lifter. So let's just say I don't even train 6 days a week, right? And I've been doing this longer than, you. And I don't mean that you should just do what I do, but if I've worked my volume up over time and I'm still not at 6 days per week, why are you at 6 days per week? I would rather you train full body 3 or 4 days a week. That's what I would do. Why is it helpful for the squat to go from heavy, light, medium 3 days per week training to 4 day per week training? More volume, more frequency? Yeah. In heavy, light, medium, 1 is squatting 3 days a week, and then on 4 day per week, 1 only squats twice a week. Oh, I wouldn't program that, so. Yeah, I wouldn't program that junk, so. Does fapping affect strength gains? No. There you go. Simple. What's the idea? Your testosterone level goes down? It doesn't. It actually goes up. The other thing is that if you ejaculate, 16 times a month or more, you had a lower risk of prostate cancer. So, that's good. London girl spilling ink. Any tips for how to improve mobility to get below parallel during squats? I wouldn't do any mobility drills. You just said you've been doing them for months now. It's still not helping, so I would just do squats. Push your knees out. Make sure your stance is correct. Yep. Macros to slowly gain weight. If you muck up percentages, which one is more damaging to go over? Carbs or fat, probably equivalent. But I don't do percentages for macros. I do calories or just total macros. My mother has pretty high cholesterol, Shannon says. She's seeing a naturopath. That she shouldn't do that because a naturopath is not equipped to deal with this. How can you convince her to see a real doctor? You probably can't because it's your mom. So, if you could CRISPR edit one of your genes for maximum gains, what gene would it be? That's, I don't know. I mean, I'm probably an ACTN homozygous mutant because I'm pretty, responsive to training, pretty fast twitchy in general. I'd like to be able to dance better. So, let's do that. Let's just do that, yeah. Saying David Ricks is short was a bit of an understatement. Well, he's not tall, all right? On a recent Instagram live session, someone made a comment referring to Lane and reverse dieting. Can you clarify the position? Can you clarify your position on reverse dieting and Lane's blunder? Well, I don't know if it's a blunder. I just think it was a mistake. Reverse dieting, I think the utility in reverse dieting has to do with people who have eating disorders and would like to binge eat if given the opportunity. So if you can get them to comply with a bingy diet, they probably do better from a weight regain standpoint. But reverse dieting, me. Can bench handle more volume or frequency than overhead press? No, not necessarily. They're the same. Diet Coke or Coke Zero? Ooh, well, I like Diet Coke over Coke Zero. Tom Capitelli, who's one of my hetero life partners, he prefers Coke Zero. But, no one's perfect. If you could only for the rest of your life do one lift, what would it be? I think I would do the Casablanca thing, at the end with the, is it Dirty Dancing or Casablanca? I think it's Dirty Dancing. Dang it. I messed that up. There's got to be a girl involved, is all I'm saying. Should I be concerned about aspartame from diet soda? No, not at all. Unloaded lumbar flexion and everyday lift activities totally fine. Yes. Yeah. MD Thrasher. Woo! MD Thrasher, what's up? Are you ready to rock, OR? That's what I feel like you are. It's just like you're in the OR, and then you're just, you're like a heavy metal person. MD Thrasher. I don't know. Okay. Female client with herniated disc. That's fine. Squatting, deadlifting, fine on LP. She, of course, has fear of worsening the injury. Any advice on how to make her feel less afraid? I mean, yes. A lot of it's just education. I mean, it's not unusual, like Tom Jones said, to have a herniated disc at probably at older age. I mean, she's old enough to have a personal trainer or coach. So, but disc herniation tends to resolve on its own. Sometimes even resorbing so where you don't have a herniated disc anymore later on. And then subsequently, even if it doesn't, your pain stops. You stop having pain. So deadlifting and squatting aren't going to make the disc worse. Not training, getting weak, getting overweight, that stuff would make it worse. So let's see. When's your first book going to be published? That's a good question. Adding weight once a week on all lifts, overhead press is stalled. Any recommendations on exercise selection to continue progress? I would press more. Yeah. Do more pressing. You can do pin press if you want to do a variation. John Mayer is better than Joe Bonamassa. Change my mind. I mean, I think that if you're combining like vocals and guitar together, yeah, I think that's reasonable. Mayer shreds on the guitar too. However, Joe Bonamassa's live album, this last one, is absolute insanity. The guy is legend. So anyway, John, you could do worse than John Mayer. I just think that people are gonna, go to his old stuff and just start singing Neon to you, and then you're gonna have to defend yourself. That's the problem. Do you think it is worth switching to a plant-based diet to avoid negative health effects associated with animal products such as heart disease? No. And I think that diseases that are associated with animal products, such as heart disease, are also associated with plant-based diets if you screw up enough other things. Just because you go plant-based doesn't mean you're going to have a lower risk of heart disease if you don't do everything else that is associated with switching to a plant-based diet, like maintaining normal weight, maintaining good exercise levels, good strength, not smoking, having good genes, probably more important than if you eat, meat or not. Let's see. Best study that proves all of foam rolling zealots wrong. I mean, forget the author now. It was like foam rolling perform and functional outcomes meta-analysis. I don't remember the author offhand. It was a recent paper. It's like in the last 4 years for sure. So, any tips to reduce foot pain after deadlifts? The tops of both feet over my arch hurts for a day or so. I don't know, what shoes are you wearing? 63 nanograms per deciliter testosterone at 21 years old. It seems like you got the units wrong on that. And is that total testosterone, or is that free testosterone or total testosterone? Because that would change things. Stiff-legged deadlift or pause deadlift for a better deadlift? I think that pause deadlift probably has a little bit better carryover for most people. Yeah. Did I see the SSOC story saying they've seen results doing another short LP after the bridge? Aside from the fact that this is entirely unproductive, would you say the results they're seeing are likely because they are using a 5RM to measure strength and practicing 3x5 makes you better at a 5RM? I think that there are multiple reasons why they might see progress. One is because you're effectively peaking because volume goes down, as intensity is going up, and your specificity is also going up, so you're seeing less variation. So if you're tracking your outcomes as far as sets of 5 or a 5RM rather, and you're only doing the exercises that you're testing yourself on, so you're no variations of the bench press, no variations of the overhead press, no variations of the squat or the deadlift, and you're just doing heavy sets of 5, and that's a significant decrease in volume from what you just did, then it makes sense that people might, have heavier weight on the bar for a few weeks. But you are correct. This is entirely unproductive, and that is the SSOC coaching at large. The best SSOC coaches don't use starting strength training methodologies to coach their clients. They use either Barbell Medicine coaching methodology or methodology that we would advocate for, and then they lie about it. Otherwise, they would get fired, which... you would argue maybe there's a philosophical problem there. Well, let's see. CrossFit just released the damage control from the Emily Abbott drug testing announcement. What are your thoughts on CrossFit HQ's anti-doping procedures where they retain authority on releasing results? I mean, I think that's very similar to other professional sporting leagues like NFL, Major League Baseball, NBA. I mean, basically they are the final arbiter of, when results get to come out of what the penalties should be. If CrossFit decided to hire USADA or WADA or both, WADA, for all their international stuff, and then subsequently USADA in the United States, they wouldn't have control over that, which would, maybe be worse. The most interesting thing, though, is that people are getting popped for all these SARMs, selective androgen receptor modulators. So, people are like, oh, I it was contaminated in my pre-workout, or it was, in my boyfriend's mouth. It's like, that's a very tough thing to buy, and then let's just say that it was a contaminated pre-workout. Like, you guys are all getting your pre-workouts from shady sources. Like, if you've got that much money, that much potential incentive on the line, you should make sure that your supplements are CGMP certified, maybe even safe for sport. You should talk to a supplement manufacturer. If you're that high level, then maybe you should probably have a supplement sponsor, and you should ask them directly about this sort of stuff, and maybe you make them pay to get it tested so you don't have this sort of blunder. The other thing is those things stay in your system for like months, so it might just be recent. So I don't know. I do think that the 4-year ban is a little excessive. Ilya is going to get to compete in another Olympics after failing every Olympic, the drug test at every Olympics he's medaled in. So who's right? I mean, and then in NFL, they do a few game suspension for a PED failure. So I don't know. I don't know if I have the answer. I just wouldn't drug test. That's how I would fix this, because people are going to do it anyway. And then if it's banned, then they're going to do it. They're going to use black market stuff, which is going to harm the health. They're not going to have doctors overseeing them, which is going to harm their health. And there's still the playing field is uneven. It's for all sports, it's always uneven. So you're not leveling the playing field by not allowing PEDs, because you're not going to handicap other people's strengths to make it all even. I just don't see it. You're not catching everybody anyway. The playing field's also uneven, and you're potentially harming people's health, right? And they're gonna do it anyway. So I think you just let them run what they brung. Best treatment for shoulder impingement, please. You should press. Yeah. Your thoughts on core workout like sit up and plank for sports like Olympic lifting and baseball? Do I think as long as you train with a barbell, it is unnecessary? I think most people should do some trunk work after their novice progression. Yeah, I think it's worthwhile. Is a potential reason that Glenn Pendley's athletes had a lot of success when they created the Texas method because they were already producing significant squat stress from heavy cleans and snatches? I mean, that's some volume there for sure. Also, they didn't always just do 5x5 on day 1 and 1 set of 5 on day 2. Some days they did more than 1 set of 5 if they weren't able to PR, which just goes to show they were accumulating more volume. In addition to that, you're talking about a highly selected for group of folks. These were high-level Olympic weightlifters who were still not always making great progress on the Texas method. So do you think that a person who's not a high-level athlete is going to make great progress on a program like that? I mean, the empirical evidence is no, they won't. And so why should you do it? Glenn Pendley still doesn't use that program. He moved on, So what is your opinion on high rep rack pulls? Yeah, I think it's fine. I program for 10s sometimes, sure. Ways to improve sprint speed. Sprint more. Yeah. Ooh, I'm answering a text. I do in fact mean 63 nanograms per deciliter total testosterone and not nanomoles per liter, 21-year-old male. Yeah, that's low if that's accurate, but you still need a second value to see if you need to be treated. Any advice for jumping higher? You need about 6 more inches to dunk a basketball. Practice jumping. Yeah. Hey, Jordan, will drinking 200 milligrams of caffeine once per week produce the same effects each week? I mean, probably. That's not enough frequency to get adapted to it usually. Yeah. FDA does not issue GMP certifications or seals, and displaying one is illegal. Here we go. So a bit long. Thoughts on this? At Transparent Labs, we get asked all the time, why does Transparent Labs not display CGMP seals on products or website? The answer is quite simple. The FDA does not issue certificate of good manufacturing process certifications or seals, and displaying one is illegal. That doesn't really make sense to me. CGMP, all that is a third-party organization, goes in and makes sure that what you're saying is in the supplement, and that your raw materials are what you say they are. That's what that means. There's other certifications out there that you can pay to get tested for, safe for sport, but nobody's making a guarantee. That's the other thing. Nobody's making a guarantee that every batch is good. They tried to do that with what is it? It's not Labdoor. It's this other one from the UK. I forget. It's like Is it transparent? No, I don't think it's transparent. Anyway. Do I have any insights into diastasis recti? My wife gave birth 2 weeks ago. Hey, congratulations. I think it's safe to train. It'll get better over time. Surgery doesn't usually help too much. It just gets better. Was surprised to see hypertrophy template is only 3 days. Was expecting to be more. When you say you can't overtrain, why a decision for 3 days? I just think most people with that amount of volume do fine on 3 days. It's pretty high volume. Although we are going to do a 4-day hypertrophy template now that we just got our new templates in. So, yeah. I had open heart surgery when I was a toddler. I still have heart murmur and leaky valve. Will performing the Valsalva maneuver be problematic when strength training? I don't know. And nobody else does either. Yeah. Do I think that doing Wendler's 531 boring but big is a decent program to follow after starting strength? No. I don't think Wendler's 531 is good. Period. People are like, oh man, well, why not? Wendler's this, Wendler's that. I'm like, look, the nuts and bolts of Wendler's 531, if you talk about the percentages used, the volume being prescribed, and the frequency, is not good at baseline, right? Just the standard 531 recommendation. That weekly LP kind of thing, it's not very good. And then if you can put lipstick on the pig and make it a little bit better, but why would you? Just start from another place. The whole PED problem you mentioned is the reason Clarence Kennedy says he doesn't compete. That seems unlikely. Man gains tons of weight and tons of strength after stops competing post-surgery while being vegan. Says PEDs are the reason he doesn't compete. Okay. Any advice for a student physical therapist who wants to incorporate barbells into training into clinical practice? Sure. Start coaching people now. Get good at coaching folks. And then incorporate them into your practice. Buy a squat rack. Travis Mash, thoughts? So it's funny. So Travis and I actually we had a little internet fight. Probably. Oh man, it must have been 2014. Anyway, longest time I don't hear from him. Don't hear anything about him. Whatever. We just go on living our lives because that's what humans do. And then I see him at the 2017 Raw Nationals, and he asked me about his hip, like we forgot, and now we're friends. I mean, internet friends. All right, it's been an hour. I've been here for an hour, so I'm gonna go. Maybe be social. Maybe make another video. I don't know. We'll see. The night is still young. Thanks for tuning in. If you're on YouTube, hit that like button. Help us out. To the 2 people who are hitting dislike, I don't like you. Do your thing, whatever. And thanks for tuning in. We'll see you guys next time.